As Winston Churchill was working to form the United Nations after World War II, he famously said, "Never let a good crisis go to waste." And I've heard that phrase a number of times over the last few weeks. Yet there is something nagging in the back of my mind around that statement. You know, every opportunity must be set against the backdrop of the lives lost, the lives that have forever been changed, and the social and economic pain that people of all ages will experience for years to come. With the COVID-19 pandemic impacting the lives of millions, the race to find solutions to the healthcare crisis has spurred innovation in most countries around the world. Just today, there was a call from Medical Technologies with a budget of €56 million to quickly deploy new solutions using medical technologies, digital tools, artificial intelligence to increase response capabilities to this COVID crisis, to improve the recovery and to better prepare for future crises. There's also another battle raging out there for me, apart from COVID. It's the battle of high touch versus tech touch. So it's a great pleasure to have two speakers with us today who know the business of innovation and technology. Let me introduce them to you. Grace Chan. Grace is the General Manager, Innovation and Technology for Aging of the Hong Kong Council of Social Service, an umbrella federation of over 450 NGOs providing 90% of the social welfare services through 3,000 operating units. Grace is one of those people that really are at the coalface, of service delivery. She sits on many influential statutory bodies of Hong Kong and the Hospital Authority. She was appointed as a member of the Consumer Council in 2013 and joined the Elderly Commission the same year. Grace's leadership and content expertise is renowned internationally in many facets, and most particularly in the world of age-friendly cities and communities. I know Grace in another way. I have the great fortune to be a colleague, and also Grace is a dear friend of mine. She's a powerful advocate for and with older people and remarkably influential. She's Vice President of the International Federation on Aging, and I have to say, Grace, back in February or March, you sent the IFA hundreds of masks and said to us, "You'll need these." And at the time I thought, that's great, Grace, but we're not going to need these. And you know what? We do, and we're very grateful. So thank you. Let me then introduce you to Mr. Simon K.Y. Wong. Simon is the CEO of the Logistics and Supply Chain MultiTech R&D Centre, established in 2006 by the Hong Kong government. This centre is charged with the mission to research and develop relevant technical solutions to serve the logistics, construction and e-commerce industries in Hong Kong. Simon has an extensive experience in the commercial sector, and Simon and I were just sharing. Simon said, "Well, I'm coming to the end of my career," and I said, "I feel like I'm coming to the end of my career almost every day, as we sit in this crisis." Before joining the centre, he held a number of technology development and management positions in Hong Kong, Taiwan, working at the General Electric Company, president of GE Appliances Asia, before that Johnson's Electric. He was highly involved in the developing supply chain solutions for customers and exploring new models. Simon, as Grace shared, is a great friend, colleague, and helps NGOs, sees the value of NGOs in the development of new technology and innovation. So we welcome both of these speakers to our town hall this morning and open the floor to Grace. Thank you, Grace.
Thank you, Jane. Thank you, everyone. I'm Grace, and I'm a social worker. And I would like to let you know that before I jump into innovation and technology, I'm a social worker. Even now, I jump into the technology, I'm also a social worker, never change. I think it is time that this sharing platform indeed to stimulate the actions to work with share aims to fight the pandemic, because across the society, COVID-19 present a range of particular risks for the older persons. First of all, I would like to provide an update on the local situations of COVID-19 in Hong Kong. Hong Kong actually extend its run without locally transmitted case to 20 days now, and it's the total number of the infections remain 1,067 with 4 related deaths, and of those total case, 900 patients have recovered and have been discharged from the hospital. The low number of deaths and also the local case adequately provide the effectiveness of the wearing the mask, social distancing, contact tracing, or quarantining. Given the older persons group, I would sum up that the strategies for dealing with the COVID-19 is characterized by 3 basics. First, recognize. Second, organize. And third is revitalize. With this experience, it's not only this time, because in 2003, in Hong Kong, we have experienced SARS before. And Hong Kong is very watchful in staying alert with all the onset of such disease happened. In particularly those group living setting, for example, elderly homes. We recognize that the older persons are amongst the highest risk populations for infections. And very sadly, death is as a result of the COVID-19. In Hong Kong, or maybe all over the world, all the care service providers have been seriously working hard to protect their residents in the nursing home. Measures like checking temperatures, restricting the visitors, canceling the activities, shutting down all the common areas, or even they do a lot of daily communications with the residents and also the families. Whereas at the same time, we are deploying a lot of innovative methods and also the technology to step up the infectious control in Hong Kong. Researchers in Hong Kong University of Science and Technologies in Hong Kong have developed one kind of coating called the antiviral coating, which could provide 90 days of significant protections against the bacteria and also the virus, such as the one causing the COVID-19. So the social welfare department in Hong Kong had launched an antivirus coating spray subsidies in early this month. This subsidy is trying to support, all the residential care homes for the elderly and also the residential care home for the people with disabilities to give the premises an antivirus coating spray. How about the community then? People would ask. But with the help of the local charities, the toxic, non-toxic coating now have been sprayed around the home for more than 1,000 low-income families in Hong Kong. Consequently, we again talking about or highlight technologies. And I think it must be, something that we recognize, and also we have to improve to reduce, the restrictions or maybe the adverse effect on the isolations under the knockdowns, which can upset our essential cares, support, social inclusions for the older persons. The second word I would use is organized. Based on our past experience, the Hong Kong government adopted containment with specific organized measures to achieve early identifications, early isolation and early treatment of those affected, as well as to reduce the population mobilities and also in populations social contact significantly. Personal hygiene or maybe social distancing are very crucial. And also in Hong Kong, we have surveillance programs, contact tracing measures conducted by the Center for Health Protections Department in Hong Kong, which I think are equally critical to identify the source of the infections. The virus is not just only a threatening of the life or maybe the safety of the older persons, but it's also the threatening of their social networks, their access to health or assessment, hospital, medical appointment, or even to their job as well. In these 3 months of working from home, business and service closure, or maybe there are some suspensions, we have a massive setback to the mental health or maybe the well-being of the older person, in particularly for those who are less likely to be digital, included. The shortage of the pandemic prevention materials such as, masks are very significant in Hong Kong. And particularly the disadvantaged community are facing very particularly tricky situation in Hong Kong. I would like to share with you as an NGO or maybe as a elderly service, the Hong Kong Council of Social Service is very concerned about the impact on these, affecting the disadvantages. So starting from early February, our colleagues almost work every day to provide the masks to the social welfare organizations. And since we receive donations of funds, materials from the fund, from the enterprise, from the business, from the individuals, we together with the 9 social welfare organizations to launch some initiatives. For the initiatives, up till now, as today, we have almost distributed more than 6.2 million masks to the people in Hong Kong. We have almost sent out 700,000 pandemic materials or information to the service user through the collaborations with the NGOs and also with the self-help organizations, with the grassroots organizations, to explain to the people that there are so many information that they have to know about the pandemic. And now we have to say that through this long times working, now we have a benefiting total of over 1 million people in Hong Kong. Besides that, we also conduct a survey in March. People said that, oh, we are crazy, to conduct survey, but we need that because we want to know, how they feel, or what is the impact of employment, childcare, or even the learning or use of the medical and social service, about the pandemic. What is the impact to them? In short, long-term illness people have less follow-up, have very worried about their health. They don't visit to the hospitals, fear about the infections. And also the respondents tell us that they have stress, bad temper, anger, insomnia, difficult to concentrate, headaches, loss of appetite, as such. And also very important is, it's not easier to find people to talk and support. And in particularly for the elderly, they are most likely, they wish to find people and to talk with them. To this specific, to develop some recommendation, I would say, for example, telehealth system, or maybe telediagnosis, dispensing of the drugs is very important, at this moment. During the outbreak, I think the government should do something, for example, set up the education or publicity on the mental health. But different group of the stakeholder in the community also, they exert their strength, to helping the community as well. At last, I'm using the word revitalizing. It is about immediate, or maybe I would say longer term policy for us to prioritize our actions. What are these? For example, we need to strengthen our social inclusions, solidarity during the physical distancing. Again, physical distancing is crucial, but we need to be accompanied by social support measures. And also we need to target the care for the older person, increasing their access to the digital technologies. And second is the overwhelming social and economic impact on COVID-19 on older persons. We need to address not just only in the crisis time, but also we need to address it in the recovery stage. And the third one is very critical, is expanding the participations by the older persons. I would say that means by we need to broaden our partnership with the civil society, with, for example, Simon R&D Center or others, or even to consult the older person to tap their knowledge, to ensure that they are inclusions in shaping up the policy or that affect their lives. Today, I would say the exceptional crisis has highlighted a lot of invisibilities of the older persons in the public data analysis. We need some innovative approach, to gather, all this clean data about them, backed up by the evidence, and then we then can use the data and then make the policy change or making the policy. At last but not the least, it is worth to exploring how technology and germ technologies helping them during the pandemic. And today, I have good friends from Hong Kong to join us and share. Thank you.
Thank you very much, Grace. I mean, what a great sort of setting the scene going forward. I particularly was struck by your closing comments around tapping the knowledge of older people and them being part of shaping policy. So that's a great segue into Mr. Simon Wong. Simon, please take the floor. Are you on mute, Simon?
Yeah, can you hear me?
Yes,
okay.
We can now.
I just jump right in.
Okay, jump right in.
Okay. Now, actually, on the evening of January 29th, I got a call from the Hong Kong government. And what we did is then we were tasked to design and make the electronic wristband for the home quarantine people. And that started a very exciting journey for us and very tiring one. What it basically is you see from the left-hand corner, the down corner, we use whatever we have at hand. We got our researchers, whole bunch of PhDs and researchers to make an ad hoc 500 units of wristband for the government to use. So that people coming back from the high-risk area, they can go back home and do the home quarantine for 14 days. All in all, in 10 days' time, we made 500 units. To cut the story short, after that, we sourced, we designed, and by now, 80,000 electronic wristband has been used by the Hong Kong quarantine people for the quarantine. And a total of 200,000 people have gone through the home quarantine using different technologies, but 1/3 of them, more than 1/3 of them, are using this kind of electronic wristband. Basically, what it does is actually you wear the band all the time for the 14 days period without any particular work. And then we put in a mobile phone or using the user's own mobile phone with an app to make sure that they stay at home. And once we find out that they are not staying at home, we do not know where they go. But once we know that they are out of the home area, then we will have people call them, remind them to do the quarantine. And if not, after several rounds of calling, then we will send people to make sure that they stay home. This has been very successful because Grace already talked about, it seems that the wristband has worked quite well. And most people that we know of, particularly the elderly, are very observant. And they just stay home religiously for 14 days without going out. Even when their food and sometimes their fruits going low, they just don't go out and put themselves at home for 14 days. Now, what I'm going to talk today is beyond this COVID crisis, what technology can help going onward with the elderly. One is expanding the use of this wristband for demented elderly. It has been, I've been working, I'm not a social worker, but I've been learning from Grace and other workers for 8 years now. I'm a technical person. 6 years ago, we have a set of device that prevent demented elderly to go out from their elderly home, but it costs us around $8,000 US. Last year, it cost us $1,000 US. Now, with the latest push in this kind of wristband, we can do it under $300 US. So one of these days, we are going to make sure every demented elderly, whether they are staying at home or staying at institution, we can help the caretaker to make sure that they are safe. And if they wander out, we can get them back or we can locate them as soon as possible. Another work we use now because of the quarantine and most of the elderly homes are not open for visits, we introduce robots to entertain them, okay? Now, these robots are actually general purpose. We are developing special lower cost robots for this home use. But what it basically does is that what any robots can do is a computer with a lot of functions that go around, that recognize the person, that can go in front of them, and then it can communicate with them now by touch screen and later on, hopefully, by chatbot. That is, they can hear what you say and they can reply in the same language. Okay. The functionalities of the robots right now, we put them into two categories. On the left-hand side is something to do with monitoring their well-being, like taking their temperature by infrared, checking their blood oxygen, which is very important now, because if something is wrong with your lung, particularly because of this crisis, if we know the oxygen level of your blood, that will be exceptionally helpful. And we can add as many as needed, various kind of health or medical instrument that can link up to the computer. On the right-hand side, then, is to help the caregivers in the centers to do more work. So because we can take up, the broadcasting of the daily food manual, news, and also, of course, by demand, they can hear music, they can hear the news, watch videos, so on and so forth. And then the robots can wander around cheering people up and without any concern of hygiene because they are, fully sanitized and they will not carry a virus from outside of the premise. And also, most of the function of wireless, then it can help adding functions or sounding alert remotely without a lot of a problem. And we have a lot of hope on this, and we are sending this kind of robots, we call them Snow White, and to learn from the elderly center what functions are truly needed and how we can keep the cost down. And on top of that, actually, another thing we're working on is help the lonely or elderly couple who stay at their own home. And this is what you see down beneath is that basically we try to put up a station with video conferencing, a smart pad, with other kind of medical instruments so that it put in a small home base in their family or in their residence so that they can go there, whereas their family members or the caregivers or the social workers can contact them remotely. And this, when we introduced that, we did not think of a virus situation, virus attack situation, but now it comes into perfect play that the social worker can take care of them or at least call them up without actually going to their home and jeopardizing them. What we add actually is artificial intelligence so that we can, for individual elderly, we can understand what they need, what are their medical needs, what a particular concern they have, and what kind of emotion they have lately. And on top of it, with the help of psychologists, we can put down what to talk about and what not to talk about. And we are working this with a university in Hong Kong with their psychological department, and we have initial very good response from the elderly. Of course, nothing is better than human touch, to have a real person to come to talk to you, see you, and visit you. But this is a very useful one, say like when you are in a COVID-19 lockdown, or also when you do not have enough caregivers or social workers to work with so many elderlies in demand. Now, all this lead to, and Grace have talked about it, in the future, what is truly needed are a lot of statistical analytics to better serve the elderly. And right now, we hope with the projects we have, we can collect data to start to understand by collecting a lot of individual people's need and their health indicators, and we can come up with trends and analytics for the NGOs and also for the government or for the Department of Health to consider. And nowadays, data analytics, particularly with AI, artificial intelligence, have been very useful. And we can do a lot of analytics, a lot of modeling in a relatively short time. And another use, which is we are working on, is artificial intelligent translator. What we use is we use in dispute resolutions because of our trade. And you can see English can instantly be translated into Chinese, Arabic, and Russian. And also we can put in forms like that. I'm just thinking about, probably too late this time, but in the next time, hopefully not, but not would, if we have another emergency globally, any kind of information can be shared globally by very quick translation, so that we wouldn't have excuse that, oh, I did not know this happened in a certain country, and it takes months to propagate to other people. We can instantly get very good information from one place to another. And this is another use of technology. Going onward with various kind of work, the good propeller that will help us is 5G applications. Actually, I talk about artificial intelligence, a lot of sensing. In the future, when 5G is more popular, all this installation of technology will be faster, cheaper, and more universal to the society. Nowadays, Hong Kong is probably an exception, but in many other countries, rural area do not have very good bandwidth. Many of them don't even have Wi-Fi or broadband. But with 5G, you can reach into very remote area or rural area and give them good service through the latest technology. And with that, I just summarize what we have done and what we are doing right now to just hopefully to excite all my social worker friends and particular in helping the elderly to see what kind of potential technology can help doing all this work better, faster, and the elderly have better care. Thank you very much.
Thank you, Simon. We've got some terrific comments and thanks to both you and Grace already. We've got half a dozen people that would like to ask questions, so I'm going to jump right in. And the first three people, and if you can keep your questions short, so we'll have 3 lots of questions and then we'll put it back to Grace and Simon. So Kathleen Brasher, Mark Benning and Greta Garnis. So Kathleen, welcome from rural part of Victoria.
Thanks, Jane. And it's a cold and foggy night, so I hope it's much sunnier in Toronto. Grace, lovely to see you. I'm aware from the extraordinary work you've done of just how involved older persons groups have been in the age-friendly work in Hong Kong. And I'm just wondering what role they're playing now. If you could just talk a little bit about that.
Okay, thank you for that. Grace, we'll just go to the next 2 questions and then come back. Mark Benning. Mark?
Yeah, so my question was to both Grace and Simon. So to what extent do you think these times will accelerate the development of Jarrett technology solutions? Maybe the word Jarrett technology could be explained further for most folks. And are there 3 top products or services that will become most valuable to meet our social needs?
Great, thank you for that. And Greta Garnis, welcome Greta.
Welcome. The question is potentially for both of you. I'm wondering, with all this data, how are you going to secure the personal information for each resident and potential family members with the contact tracing? I don't know if a HIPAA would apply to this type. I know HIPAA is probably only related to the States, but I was just wondering, with all that personal data floating around out there, how do you protect it?
Okay, thank you. So Grace, would you like to just pick up Kathleen's question?
Yep. Kathleen, nice to meet you here. We never stopped doing the age-friendly campaign, because I think this is absolutely very useful and powerful to get involved with seniors. Now they have 2 strong engagement. First of all, they are becoming the technology ambassadors, because it seems that with their support, they become a peer counselor. They become a good persons to introduce technologies to their peers. Another great areas that they jump into is the fintech. I have involved in a study, and people would be interested, all these electronic payment, because now the world changing so quickly. They don't know, how to, pay for example, in the COVID-19, they even don't know, the online, shopping, something like this. But it seems that they need somebody to teach them, or maybe show them how to, use all this technology. I think age-friendly cities is something that they can get involved, not just only the concept, but also they can learn in particularly from themselves, and then they help each other. I think this is the areas that I would like to share with you at this moment.
Okay, thank you.
And also, if you don't mind, I would like to highlight Billy in Hong Kong, because I think he is going to share a project in his organizations. It's also about tapping the older persons to solve the digital inclusion problems. Billy, do you want to share something?
Hello. This is Billy from Hong Kong Evangelical Lutheran Church Social Service, and so we have a very good, I think it's a very good project called Lifestyle Reactivation Project, and it is supported by the Jockey Club, and we try to use the Internet of Things and to connect the older people with the technology. So just as what Simon said, we put tablets like this. Can you see that?
Yep.
Yes. And then put it in the elderly's home, as what we are serving is the homebounded elderly, and we connect this tablet with with the thermometer, with the oximeter and things, so that they can monitor themselves. And of course, we've made more than 80 videos of exercising, and so that the elderly can schedule their time, and then we can schedule their time. They can watch a video tailor-made for them to do the exercise, so that they have something to do in the time they are homebounded. And of course, we can also share some kind of videos and things as at their interest, so that they're connected, and with the video conferencing ability of the tablet also. So
Okay.
so we're doing that.
Thanks, Billy. Perhaps you could put any resources that you've got or links into the chat box for us. That would be very helpful. So I want to go back to Mark's question about what is Gerund technology, and what are the three products that you would be saying that are important? So Simon or Grace?
Okay, I can give some of my thoughts on it. Okay, one is that after this COVID-19, the tremendous help is that if you look at the electronic device we talk about, and also robots and this remote, what other countries say telehealth, but we stay away from health because this is a very sensitive issue in Hong Kong. It remains in the realm of a hospital authority, but at least for tele health care to take care of the elderly, particularly emotional support, these three fronts are very useful. And because of the COVID-19, it has helped increase the impetus, okay? And another thing is that we talk about data analytics. Here, I need to talk a little bit about Hong Kong government did not have a mass scale contact tracing. We did not do that. What we did is that we make sure that they stay at home, and once they leave the home, then we try to contact them. And when we try to contact them, it's really what they leave to the Department of Health. So other than that, it's very minimal, not like the contact tracing. The contact tracing now, the most secure way still seems to be provided by Google and Apple's iOS. However, the problem is that they require the government to do it. Actually, the Hong Kong government will not do it exactly because of the privacy issue. So we are in a bind over there. Okay. However, having said that, when I talk about data analytics, data analytics is very important because we don't need the individual's data. We need the group's data on their, say, like temperature, their emotion support, that we can tell global or macro information from whether we have a very sick or people tend to have more high temperature lately. These are the kind of useful information we can extract. Thank you.
Okay, look, thank you. I'm just going to give a cue to the next three speakers and go back to Grace to define Gerund technology. So Cynthia Stewart, Mike Runge, and Jane Simmons. So Grace, would you just like to share your definition of Gerund technology with us?
Well, I've been asked these questions many times in Hong Kong, because it is a mix of the words Gerund technologies means what we call the technology plus Gerund tech. Now I forgot the words. It's what's it called? The Gerund technologies is Gerund. What's another word? I almost forget now.
There's geriatrics and technology.
Yes. Just absence of words. To me, it's not something that from a science point of view. Actually, I would say that it's from the seniors point of view, because Gerund technology means that from the demand side, from the user, they're driven, for example, they want something to support them to have independent life, or maybe a better, life to have more dignity to support themselves or the daily livings. So germ technologies is start from them. It's so different. Some people would use, germ technologies on the furniture design. Some of them they will use in the IoT things. But it's something that we have to, start from the where the client is to define these words.
Okay, I'm going to ask Cynthia, Mike, and Jane, but also, ask you and Simon, the broad question: does COVID accelerate the development of innovations and technology pertaining to creating an environment that an older person can more comfortably live in? So I'll leave that out there. So Cynthia?
Yes, this is a fabulous webinar, so thank you both speakers. My question is about experience as well as the technology side in working with deaf and/or blind older persons, and what experience you might have with that. I know there's technology for blind and for deaf, etc. What experience, if any, has Hong Kong had in reaching the deaf-blind older population?
Okay, and I'll also add to that a bit of a curly question and note Megan Acton and her spotlight at IFA. The use of masks, with people that are hearing impaired or vision impaired. So I'll leave that there. Mike Runge from South Australia.
Thanks. My question's particularly to Grace. Grace, I was very interested in your comments about the engagement of older people in the invention of solutions, and wondered if you could talk to us a little bit about that, and particularly whether they've come up with any surprising solutions that might be different to what we would normally be doing.
Okay.
Thanks, Mike. And the last one, Jane Simmons.
Hi, I'm from South Africa. Although we have a high mobile phone influence in the South African communities, there's a sort of, I would say, a lack of data and Wi-Fi, and moving from a cell phone, which is text messaging, to sort of WhatsApp or something more sort of sophisticated in terms of technology. And I just wanted to know, is the assumption, or is it a misrepresentation that we feel that older people are slower at taking up modern technology and moving on to data and to apps and things? Or has anyone had experience of moving with older people who have not been experienced to Wi-Fi and data, tablets, and what sort of the uptake and problems and challenges faced there are?
Okay, thank you. So first question from Cynthia was about, have you had any experience in working with people who are deaf and blind in this environment? Grace and Simon?
If I may talk about technology, Grace, you want to talk about it first?
Oh, no, Simon, you do it first. Yes.
I have two technologies from Hong Kong that I know of. One, I'm involved with the visually impaired. When we talk about blind, it does not need to be totally blind. When people get to a certain old age, like over 85 or 90s, they start to have visually impaired problem. A lot of new technologies are working on. One that we are working on is a smart, what we call the guiding stick, actually with a sensor at the end of it. But that needs to have an infrastructure, very cheap RFID, what we call the RFID tag, put on the guiding tires or put on the street corner under the traffic light. So with that, you can walk around with very accurate location. But the newer one, we are looking for making an electronic guiding dog. Hopefully one day we can get that done. And all these are actually for the visually impaired. On the deaf one, the latest technology they have is using AI, artificial intelligence, to block out all the, what we call the unrelated, irrelevant background noise. So that you can say, like, if I want to hear Jane among 10 people who are talking, it will focus on Jane instead of others. So a lot of new technologies are coming into play.
Okay, thank you, Simon. Grace?
Yes, Jane, this section is very challenging. I try to answer 2 questions in one answer.
No, just do your best. I'm throwing everything at you, so just do your best.
I'm very excited to share because definitely I saw a product. It's for the people with visual impairment. It's from Israel, but they try to localize, the product in Hong Kong. What is this? It's like a glass, and actually they got a very little part attached to the glasses. When you touch the glasses, and then the glasses can see, you can see from the glass, but the people with visual impairment cannot. But the glasses can, read what is in front of you in your own language, for example, in English or in Chinese, so that people can, read, enjoy the reading, but the noise of the voice of the reading is not very loud, just only read to you. Another questions related that the innovation or the seniors should try is these particular glasses. Eventually in Hong Kong, we are not just only for people with visually impaired, but actually we can use it for the people with dementia, because you can imagine that people with dementia may not recognize their family members, but you can imagine if you wear the glasses, and then also the glasses always telling you that in front of you is your daughter or your son or your husband. That would be fabulous, because the glasses not just only read text, the glasses can recognize people as well. And for the products, Jane just mentions in COVID-19, is there any, things, or maybe the environment push up, to have more products in Hong Kong? I can tell you that yes, because for example, today I have Science Park person, he's also called Simon. Maybe he can, share a little bit, because in last 2 weeks, we have a conversation with another Simon. He gave me, a lot of new company products on combating the COVID-19. What we do is we have to find the NGOs, the elderly homes, or maybe the center, to try, the product for them, so that, we call it a testing ground. So both Simons are my buddies in Hong Kong, because from the R&D center and also the NGO side, we can join them together to do some testing of the product, and then make sure that it works on people and adopted by the elderly. And in the process, definitely we will engage seniors to give opinion as well. Simon from Science Park, do you want to add anything?
Yes. Yes, thank you, Grace. So this is Simon C. So maybe I shared this screen.
Simon, if you can be quite quick, because we're coming towards the end of this session. So we just got a couple of other questions that we need to get answered.
Yeah. Yep. So there are 2 types of products that Grace mentioned. We are developing in Science Park. We have some companies developing a wearable which originally aims to measure the oxygen saturation and some vital signs. And turn out this COVID-19 outbreak, so that device is customized to use on the monitoring of the health status for COVID-19 patients. And this product is developed by a company called Balloon Technologies, and they just got a 510(k) approval from the FDA. So, and this product we also would like to use in the elderly center for the health monitoring purpose too.
Okay, it would be good if you could give us that resource. That would be helpful.
Yes, yes.
Okay.
And then we all, in the park, we also have a bunch of companies developing disease monitoring device too. So one of our company called Senwa Biotech, they have come up a desktop device which can offer a very quick detection of pathogen. So it's and the operation is so simple that you just drop in, you just add in a drop of blood and then put the cartridge back into the desktop machine. Then you can get the result in 15 minutes.
Well, it seems as though we almost need another session just to talk about the various technologies. So if anybody wants that, just drop your chat in the chat box. So Grace, I want to go back to you and the question that Mike Runge posed, and he helpfully just posed another one that, you know, if you were planning a nursing home now, you know, what would the differences be? Hold on, I'm just, if you were about to build a new nursing home now, how would it be different from a pre-COVID nursing home? So if you can quickly respond to Mike's first question and second one, and then we'll Jane Simmons, and then we'll start wrapping up.
Okay. This is my dream actually. During the pandemic, I have think about how about we should have a 5G, you know, long-term care facilities. We are talking about we need to build a lot of IoT things to, you know, collect the data, or to facilitate, you know, the continuum of cares. And to me, it's not just only the residential home, but if we can have a very good system of the data management, that means from the aging in place to residential home, or eventually caregivers, you know, we can have a bunch of, you know, data to support them as a program or maybe the policy.
Look, thanks, Grace. The last question is from Jane Simmons, and it was really about, have you or Simon experienced any issues related to older people being able to use technology?
That has been the case all the time. In the 5 years ago when we started to do that, we got a lot of problem. The elderly people, particularly people over 80 years old, they got turned off instantly. Now, fortunately, and I think this will be a universal phenomenon. Nowadays, we talk to the 80s. Some of them, not all of them, actually can use smartphone very, very adroitly, because they need to talk to their grandchildren, they need to play games. Now they are a lot more really smart about using this kind of devices. I think it's psychological because they do not think those are foreign objects like the old days. They are not against it. So I'm looking forward to it in every place. Maybe it does not happen now, but in a few years' time, I am sure that that can easily be overcome. But all people need to live longer to achieve that purpose.
Oh, good point, Simon. Thank you for that. That's a good note to wrap up on. So what is your takeaway message, Simon, and then takeaway message, Grace?
My takeaway is for the past 8 years, I learned a whole lot about taking care of elderly from the social workers and also from the healthcare professional. Technology helps, but we have to be humble and learn from zero, from ground zero, from all these experts, how technology can help. So this is two different things. One is, sure, technology can help, but you need to learn how to apply technology in order to help. Thank you very much.
Thanks, Simon. And Grace, final comment?
Yes, I always believe human touch, and I always believe collaboration is the key. I think this is the take-home message.
Well, I don't think that we could be wrapping up on with any finer comments. We have to be humble, human touch, the application of technology to create the environment that an older person can not only survive, but they can thrive in. So we've had lots of great comments and we need to do another session. That's what people are saying. So I'm afraid I'm going to come back to you, Grace, and I'm going to grab your thoughts and that of Simon's. So in wrapping up, thanks everybody for being on the line, to the IFA staff who are just so committed, lovely, generous and patient with me. Andra, particularly for her project lead, Chesley, you know, communications manager. Enjoy your time with your family, Chesley, as you fly off to Calgary. Next week, a very important session, and that's with Dr. Darren Hayland, a critical care doctor and professor of medicine at Queen's University, talking with us about, is COVID a threat to person-centered care? So we welcome you to register and to be part of this, and any comments, criticisms, suggestions, they're all welcome. So we'll see you next week or at some time in the future. Stay safe and well. See you then. Bye.
Yeah.
Thank you very much.
Bye.
Bye-bye.